Hello everyone and welcome back to my channel. My name is Maria and I'm a Masters of Nursing student, and in this video I'm going to be doing a tips and advice video on nursing interviews and nursing selection days as well. So if you guys might remember, in my previous video, my nursing Q&A, I asked you guys to ask some questions that you'd like for me to answer in my Q&A, and so many of you guys got back to me, asked me, oh, what questions did you get asked? How was your interview process? What did you wear for your interview? How did you get prepared for your interview? Was the maths questions you were asked really hard and stuff? So I thought, because so many people asked me for it, I'm just going to do like a whole entire video for it, and this is what this video is going to be about. So I just want to say, first things first, before like you guys go any further with this video, I just want to say that this isn't going to be the sort of video where I'm just going to give you like a list of questions that I was asked, or a list of questions that I've known people to ask, or a list of questions that you might be asked. Rather, what I want to do, I want to like introduce you guys or reintroduce you guys to new ideas that I feel like will form the foundation for the questions that you might be asked. I feel like chances are, if I gave you guys like a list of questions that you might be asked, chances are they won't come up. And as well, like these nursing assessors, they're switching the game up. So don't be surprised if they ask you a question and you're thinking, what the actual heck? Like that has nothing, or I feel that has nothing to do, you know, with being a student nurse or with being a nurse in general. And also I will say, like, as part of my volunteering, like I interview people on a regular basis, and it is so obvious, guys. It is so obvious to, you know, differentiate, to tell difference between people who have just literally rehearsed like possible interview questions, and the difference between people who actually understand what they're actually saying behind the answer that they're given. So if you have like any questions that you'd like to ask me, or any comments that you'd like to share with like the rest of the community, you can always put a question in a comments box below. You can email me, you can DM me on Instagram, or you can also snap me on Snapchat as well. So yes, I hope this video is helpful. If it is helpful, make sure you give it a thumbs up, and if you haven't already done, make sure you subscribe to this channel. Most of the videos that I upload on this channel are nursing related. So let's start. We're going to start with a lot of the basic stuff, and the reason why I call it the basic stuff is because I feel like interviews aren't won or lost on the, you know, next couple of like factors I'm going to say. So what you're going to wear, very quickly, try and wear something smart. For my interviews, I wore a long black dress, and it was quite figure hugging, but it wasn't too tight where I felt uncomfortable. It was a long black dress. It came to below my knees. Make sure, I wouldn't recommend you taking a mini skirt. If you can, go in trousers, but if you are going to wear a dress or a skirt, make sure it goes below your knees, because some of your interview or your selection processes, you will be doing a lot of, you might be doing like a lot of group activities or a lot of hand activities where you're going to have to be walking, moving around and stuff like that, and it isn't always the best idea to like wear really short skirts. Same goes with like really tight trousers as well. If you are going to wear skinny jeans, make sure that they are completely pitch black, or make sure that they are completely like dark, like navy blue, like the indigo trousers. And also make sure that if you are wearing skinny jeans, that you can stretch in them. I know some people think wearing skinny jeans is unprofessional, but in this day and age, like, I interview a lot of people who wear skinny jeans, and I feel they just look just as smart as people who come in with like the formal trousers. Yeah, you can also wear formal trousers as well, but yeah, I'd recommend wearing a pair of black or a pair of blue trousers with like a shirt or a nice blouse or something, and then obviously appropriate shoes depending on, you know, where you live, what the weather's like and stuff. I wouldn't recommend wearing dolly shoes if it's pouring down with rain. You don't want to feel uncomfortable throughout the whole day because you've worn inappropriate clothing. Believe you me, I have seen it. I've interviewed some people, and I've seen other people who have been interviewed with me who just look super uncomfortable because of what they were wearing. You know, when they look to me, they're like, oh yeah, this is stylish, oh, this is so figure fitting, and this is, you know, so cute and stuff, but that's not what the interviews are looking for. As long as you look professional, your clothes are clean, you iron your shirt, you iron your trousers, that's fine. If you don't have any formal trousers, or if you don't have any like plain skinny jeans, I know Primark do, you know, pretty suitable skinny jeans, or you can get the formal trousers from Primark for around £5. I know Tesco's do it, Asda's do it, just a basic pair of black trousers. The next thing you want to think about is, how are you going to get that? I know for one of my interviews, the university that I'm actually at, I actually had to get to the university, or I had to travel to the city the day before, because that was just the cheapest and the most practical way for me to do it. Make sure, if you're going to have to take train, if you're going to have to take, sometimes people have to fly out, like if you live in London and you've got an interview in Edinburgh, make sure you pre-plan how you're going to get there. Like, I'm not talking about pre-plan 2-3 days before, I'm talking try and pre-plan at least a week, at least 2 weeks, especially if you're going to be flying out or if you're going to be taking train, because I know prices are a lot more cheaper, and you don't want to say, oh, I don't think I'm going to go to that interview because it's too expensive. Like, that university might actually be the university of your dream. So make sure you plan things ahead, and if you are going to have to stay a day after your interview, or get to the town or where the university is located, if you're going to have to get there a day before, make sure you prepare all of that. And please make sure you are on time, because that I don't know, that's just my pet peeve, but I just find it so unprofessional. And you know, people say they're going to be at an interview or at a selection day for like, I don't know, 9 in the morning, 2 in the afternoon, I don't know, 4 in the evening or whatever, and they're late. It's so unprofessional. If you feel like you have any of the slightest chance of being late, for example, you've got to pick up your sister from school, you've got to drop off the kids at their grandma's house, or I know you're working your part-time job, if you feel like that is going to make you late for your interview, either cancel that or email the university and ask them if they can rearrange a different interview or assessment day. Trust me, you do not want to be late for your interview. I never said that interviews aren't made or lost on these basic factors, but I feel like with lateness, I think that does have a massive impact. Another thing that I will say is make sure you take a notepad. It can be like a little flip chart. It can be an A5 piece of notepad paper, or like an A4 book, and make sure you take a couple pens, a couple pencils as well, and also make sure you take a bottle of water. If that means you're filling up a bottle of water at home, or you buying a bottle of water on the campus, university campus, before you actually start your interview, make sure you do that. So take notepad, take a couple pens, because when you really need a pen, that's when it's not going to work, even though it's brand new. Take a couple pens, take at least one bottle of water, and also take some snacks as well. Because I know sometimes when I'm nervous, or if I'm feeling a bit, you know, not nervous because I don't really get nervous, but if I'm feeling a bit, you know, anxious and stuff, sometimes just drinking some water can just make all the difference. So let us get into the more interesting, the more juicy stuff. For you guys who have like continued and, you know, stayed in this video, the more juicy stuff. I will say that I'm going to be talking about 4 main factors. 3 of them I have directly experienced through my own interview processes, and 1 of them I haven't experienced, but I have observed, and I have heard of other nurses and other student nurses telling me that this was in their interview/selection process. So I'm going to be talking about a maths and English test, which a lot of universities are starting to incorporate into their selection process. The actual individual interview, which I also experienced, which most people, actually no, for one university I actually didn't experience. Actually, for the university I go to now, I didn't actually have an individual interview. And then what's the third one? Third one is group activities, group discussions. And then the 4th one, which I haven't actually experienced myself through the actual nursing selection, but is simulation events. Is it simulation events? Basically, like when people are acting and they put you in that situation. You see, there's actors and you want to see how you react, just to give them an idea of how you cope with pressure, or how you cope with unfamiliar things, or how you cope with, you know, meeting new people, and, you know, all of that, the wider implications for what that means. So let us get into the juicy part. So the first part is the individual interview. So I do have my tablet here, so I'm going to be looking back and forth at my tablet and at the screen, just so I don't miss anything out. So the main point of the interview is for the assessor to assess you. And when they're assessing you, they want to see that if your values are in line with their values, if your values are in line with the ethos of the university, if they're in line with the NHS's principles, and if they're in line with nursing values and nursing principles in general. So make sure you actually know what the ethos of the university is. Make sure you know what the NHS's values are. I'm not saying it no word for word, and make sure you also know some of the values that, you know, good nurses display. For example, compassion, the ability to reflect, the ability to communicate well with one another, the ability to, you know, promote health and to encourage not just the patients you're helping to care for, but also the people that you are working with as well. So make sure you have a basic idea of basic nursing principles, the ethos of the university, and, you know, some of the core values of the NHS. Because at the end of the day, we will be spending, when we graduate and also on our degree, we will be spending a lot of the time in the NHS's hospital. So we want to, you know, have a good idea, because that way when we do know what the values are, we are able to reflect that. I know a lot of the values, such as compassion, such as a caring attitude, the ability to work well under pressure, the ability to, you know, relay like a lot of information to other people, will be inherent in us. But I feel like when you're made more aware of it, you're better able to reflect that to others, especially when you know that they will be assessing you on that. I would highly recommend you guys familiarize yourself with the 6 C's. For those of you guys who don't already know what the 6 C's are, they're basically just statements that basically underpin compassion in nursing practice. And I will say as well, for a lot of the points that I will be like introducing or reintroducing to you guys, I will try and find, you know, suitable resources online, and I'll put the links of those will definitely be in the description box as well. So make sure you familiarize yourself with the 6 C's. I feel like from that, basically a lot of the interview questions might be not easy to understand, but easier to answer from a nursing perspective, because it's very easy for an interviewer to ask your question and you answer it very well, but it's not specific enough for nursing practice. So make sure you go over the 6 E's and just go over nursing principles and values in general. Also know that there have been occasions in nursing practice where nursing care has literally been beyond par. Like, it's just been completely unacceptable. We know the Winterbourne View report, we know the Francis report, and some of us might even have like direct experiences with ourselves, with our friends, with our family members, where care has just been completely inadequate. So what I feel will be helpful for you guys to do is just to explore what this actually means for nursing practice. How does it change the way that we need to operate as nurses? What can we do as a community, or what can you do as an individual to ensure that, you know, inadequate care never happens again? Another thing I want to tell you, just to try and take your thoughts a bit further, just so we can explore, you know, bad nursing practice in relation to nursing interviews and nursing values and nursing principles, is like, what does that actually mean for the nurse? Does that mean that the nurse was a bad nurse? Does she completely have no compassion? Should she have never have been a nurse in the first place? How do you feel, or how do you think a lot of the nurses who were involved in the inadequate care, why do I keep saying queer? How do you feel that a lot of the nurses who were involved in the inadequate care got to where they are today? I'm talking really fast. That's because I'm really passionate and I really want to help you guys and give you guys as much information, because we are the nursing future. So yeah, were the nurses evil? Was it a lack of compassion, or what was it? Were there other things in the environment that impacted the way that they behaved? What can we do to stop stuff like that happening again? The next point I want to try and talk to you guys about is nursing campaigns. Are you guys aware of any nursing campaigns, any nursing schemes, any service improvement projects? The reason why I said this is because for a lot of you guys who, you know, I believe a lot of you guys will be going on for further education, whether it's an undergraduate or a postgraduate, master or PhD, service improvement projects, schemes and campaigns will form a massive part of your nursing learning further down the line. And the reason why I want to say that I feel like you guys should explore these ideas is because it just gives you something to link some of your responses back to. You don't just want to give your interviewer a basic question. You want to show that you actually have real life understanding. You don't have to have real life experience, because a lot of, you know, student nurses have, prior to getting onto course, they had no hands-on experience, but you want to show that you have real life understanding on how your answers actually link back to what is actually happening in the real world. If you're aware of any nursing campaigns, or if you're not aware, make sure you go out there, you check on the internet, you talk to your mum's sister who's a nurse, and you talk to your dad who's a doctor, and your cousin who's like a, I don't know, an occupational therapist, and ask them like what schemes, what initiatives. It doesn't directly have to be related to nursing, because remember that nursing doesn't just exist on its own. No, we work with so many other members of staff. We know we are part of the multidisciplinary team. We work with doctors, we work with OTs, we work with therapists, we work with radiographers, we work with social workers, we work with carers, we work with so many other people. So don't just think that you can only go to other nurses or other student nurses to help. If you do find any other videos, whether on YouTube, whether it be from doctors, whether it be from midwives, whether it be from OTs or anyone like that, make sure if they do have a video outlining interview questions or, you know, interview tips and advice, make sure you check that. Don't just limit yourself to you know, like just nursing videos and stuff, because a lot of the stuff you can learn from them and transfer it into your nursing interview. So I will recommend that. If you aren't aware of any schemes, make sure you look at that. Just to give you guys an idea, the butterfly scheme, I'm not going to tell you what they are, because I want you guys to actually go out there and research it. The butterfly scheme and the sepsis 6. Sepsis 6, in my opinion, isn't really a scheme, but it is something that every single nurse who is in the NHS knows what sepsis 6 is, regardless of whether you're specialised in cardiology, you specialise in renal care. Every single nurse knows and must know what sepsis 6 is. So it's really important, I feel like, for you guys to know. So make sure, I just don't want to tell you, like, it's easy for me to tell you, but I want you guys to explore, I want you guys to expand. So if you don't know of any campaigns, make sure you go out there and just find one or two and just read about it briefly. Another thing that I feel would help you guys in your selection process is the structure of the NHS in terms of the nursing workforce. We now have, you know, so many different levels of nursing. We have healthcare assistants, we have healthcare practitioners, we have advanced nurse practitioners, we have emergency nurse practitioners, we have the registered nurse, we have nurse and associates. I think it's important for you guys to think about, why is that important? What does it mean? How does the introduction of the nurse and associate affect your nursing education? How does it affect your role as you know, a registered nurse, a band 5 nurse when you qualify 3-4 years down the line? What does it actually mean? And like I said already, the reason why I'm not giving you guys a list of questions is because I feel like a list of questions just limits you. And I can tell you, hand on heart, it is so obvious to, you know, identify people who have literally just rehearsed questions than those who actually understand the ideas behind what they're actually saying. That's why I don't just want to give you guys a list of questions. And like I said already, chances are if I do, they probably won't come up. Oh yeah, I will say as well, make sure you check out the description box for any information. If there's any bits of advice or any tips that I've completely missed out at the time of filming this video and it's come up to me editing it, I will put it in the description box. So make sure you click the description box. All of added information, if I feel like I've missed anything out, and resources as well to help you guys, will be in the description box below. So now let's get into the second part. We kind of briefly talked about, you know, the maths and English test. Did we talk about the maths and English test? I don't think we talked about the maths and English test. Okay, so we briefly talked about the actual interview, your individual interview. Now we are going to talk about the maths and English test. This is going to be a very quick section because there's not really, I feel like there's not much to it, but I will say revise, revise, and revise. It's very easy to think, oh yeah, it's just going to be like basic maths. It's just going to be like basic English, like how do you spell dog, D-O-G. Trust me, it's not like that. If you don't prepare, you will fail and you will not go any further in your interview process. Trust me. A lot of the interviews or a lot of the selection days that I went to, the maths and the English tests were at the beginning of the day. And let me tell you, I don't want to be dropping names of some universities, but some universities are absolutely brutal in their selection process. And in fact that you'll do your maths and English test first, and then you'll have the group discussion, and then you'll have the individual interview. And basically what they do is spread over the whole entire day. You do your maths and English first, your maths and English test first, which is usually timed. They'll mark it, and if you fail your interview questions, or if you fail, not your interview questions, if you fail the maths or English test, they'll ask you to go home. If you do pass the maths and English test, you go into the next stage, the group discussion. If you fail the group discussion, they will ask you to go home. And those who pass the group discussion will go on to the interview stage. In my opinion, I just think that's just kind of brutal. But it's just no nonsense. You know, a lot of people want to be student nurses, want to become nurses, want to work in healthcare in general. So I kind of understand why some universities do their selection days like that. But okay, so the maths and English test, very quick section, like I said, but I've already waffled on anyway. The maths and English test, from what I experienced, a lot of it was GCSE maths and GCSE English. I did pretty good at GCSE maths, GCSE English, but I can say hands down, if I did not go over my GCSE textbooks, if I did not utilize bite size to remind myself how to factor up and factor down in a proper systematic way, I probably would have struggled with it. Like, I don't want to say struggled with it, but I would have been picking my brains about it a bit more. Whereas if you go on bite size, if you go back on your old GCSEs or English papers to look at like grammar and stuff like that, it just kind of re-emphasizes it. Because when you think about it, yeah, you did your GCSEs so long ago. Not everybody's done A-level maths or A-level English, and you forget a lot of it because not everyday life you're learning how to factor up or factor down or how to divide 10 by 1,000 and stuff like that. It's not every day you do that, so you've got to have to make sure you go over that. And I will say, even if you have studied A-level maths or A-level English, I would still recommend that you go back to your GCSE level or level 2 English and maths and basically go over that. So that's what I would recommend. Some of you guys might be aware, I do have a video called Why Are Drug Calculations So Hard? And in there, in that video, I basically talk through some of the drug calculations that you might come across. So if you haven't already seen that video, if you have already seen that video, once you've watched this video, make sure you go refer to that. And I feel like that should give you an idea of some of the questions that you might be asked during the maths and the English selection process. In terms of the English, make sure when you write, your handwriting is legible, that you can read it, because sometimes I write and I look back and I'm like, what did I write? So make sure you can read it, and make sure someone else who's never met you, who's never read your handwriting, can read it before. When you are answering questions, literally read that question like 10 times. Don't read it one time and write it, because I've got the habit, I'm not the best, I did good at GCSEs English, but I'm not the best at writing in general. I've got a habit of reading the question and turning it into what I want to answer. Make sure you read that question at least 2-3 times. Think about what you're going to write before you write it. I think a lot of time with English, the English related questions, they want to see your thought process. While grammar and spelling is very important, I don't feel like you're going to win or lose your interview based on how good or based on how poor your English was, just as long as the idea is there. That is it with the English and maths test. So now we're going to go into the third thing, which is the group interview or group discussion. Now you will notice that when you're in a group interview or group discussion, you can be placed in pairs, you can be placed in groups of 3, 4, 5. And one of my interviews, I was actually placed, I believe, in a group of like 8, 9 or 10. So there are quite a few of us. And you will have like a couple registered nurses, a couple maybe other student nurses who are already on their course. And you also will have a couple of people who are just healthcare related, observing you. Most of the time they will have a bit of paper, ticking down, writing things down as you say, or ticking check boxes and stuff. So the first tip that I'm going to give you guys for your group discussions and for your group activities is please try and include everyone. And I'm not saying it in a way like gather audition and be like, oh, so what's your idea? So what's your idea? So what's your idea? So what's your idea? And not actually think about what you're going to say, or not actually say anything to yourself. But if there is anyone in that group who is painstakingly quiet or who doesn't say anything, I would recommend you say your point, for example, say that and then say, oh, Jessica, or oh, Rob, or whatever, what's your idea on it? Do you know what I mean? Like, please include people. I feel like that just shows that you're a team player, as well as you being able to work independently as a, student nurse nurse or as a registered nurse, you're also able to include other members of the group. Another thing I will say is try not to talk over other people, but if you have to talk over other people, if there's that one person in the group who really won't shut that up, yeah, and you might actually have to talk over people. But I will say, articulate your thoughts. Don't just say stuff just because you're like, oh my gosh, it's been like 5 minutes and I haven't said anything. Sometimes you need to completely block out what other people are saying and say your own point. And don't worry if you've said your point and you're thinking, oh my gosh, I've just repeated what she said and I've just added a bit onto it. Don't worry. But main thing is try and include others, be considerate of other people in the group, but also make sure you get your point across. And please don't just say stuff just because you feel like you have to say it, because it's just so obvious. Like, as an observer, as an interviewer, it's so obvious. Sometimes, especially when you're in bigger groups, and I can find as well when you're in smaller groups as well, you feel like, oh my gosh, she said it twice, she said something, she said something, she said something, he said something, he said something. Now I've got to say something. Think about it, because you don't want to say something and then have to backpedal. Like, that is just, I don't know. Like, there's nothing wrong with backpedaling, because obviously people will introduce new ideas and stuff, but you want to expand on what other people have said. Like, you could say, oh, the rainbow has the colour red in it. And someone else might say, oh my gosh, there's so many other colours in the rainbow. And then you can say, yes, the other colours in the rainbow are absolutely beautiful. Not that you say, oh my gosh, the colour red is in the rainbow. And then someone else says, oh yeah, there's so many other colours in the rainbow. And then you're like, actually no, the colour red isn't actually in the rainbow. I think it's just orange, blue and green. Like, don't like backpedal unless you've made a complete dire mistake. If you have said something completely ridiculous, like NHS stands for National, I don't know, House Systems, then you gotta backpedal. Yeah, just if you say anything crazy like that, just get up and go. But yeah, that's the tips and advice I will give you for the discussion section. No, okay, I want to add a bit more. Oh, this video is gonna be so waffly, but whatever. I just want to give you guys as much information, and I want to expand your mind so you're not just preaching stuff and not just relaying stuff because you heard some random girl on the internet say it. I actually want you to say stuff with confidence, knowing that if someone or when the interviewer takes you up on that, you can actually back up what you're saying. Another thing I want to say is just be very careful, because some of the topics that they talk about, or some of the topics that you may be given as part of the group discussion, group activities in general, can be, for some people, can be sensitive. So just be aware of other people in the group. Really be aware of other people in the group. And one way you can do this is when you come into like the selection day, if you see other people who you feel like might be on your selection day, just introduce yourself. I know it's super hard, but you're just gonna have to, girl. And that way you can get a better understanding of, you know, who they are and where their headspace is at. I would say that for 2 of the nurses who were interviewing them, 2 of them were overweight, and then they posed a group discussion. Oh, what do you think of overweight nurses, and should they be able to work as nurses? And just be very careful in your delivery. There was one girl in the group discussion and she was just so brutal, like, and I was just like, are you for real? Like, are you actually for real? And they also asked the question of, oh, what do you think of nurses who smoke? So some of the questions can be very sensitive, so if you can, try and get to know the other people that you will be in a group discussion with. If you are not, just be who you are. I'm sure that you'll only spew and talk about, you know, positive things. Obviously highlight the negative, but not in a way that will make people feel bad or make people feel inferior. That just isn't on. I can guarantee you that girl didn't get into the course. Now I'm gonna very briefly, I say briefly, but I'm gonna very briefly talk to you guys about simulation events. I'm not sure if it's stimulation. I think it's simulation events, basically where there are actors in a room and they put you in a room and they want to pretend you're a registered nurse or pretend you're a family member or pretend you're a patient and just see and observe your behaviour. I know some universities that do it, and in my opinion, from what I've heard from other student nurses, they can be pretty brutal. Like, I'm going to be completely honest with you guys. I just want to give you guys a heads up. I'm not going to drop the name of any universities, because I do know one university in particular who has actually started to introduce it. They come with advantages and disadvantages. It depends on how forceful or how, let me not say forceful because that's a scary word, but it depends on how active the simulation actually is. So I will say for the simulation, I feel like the main objective of simulations is to really see how you interact with patients. Yeah, how you interact with patients. A simulation event could be, I don't know, you get a nursing handover, someone gives you a nursing handover and then you've got to continue the care. Don't just look at the handover. Obviously take on the information from the handover. Go over and meet the patient. Say hello to the patient. Say, hello, my name is blah, blah, blah. I'm the student nurse or I'm the registered nurse looking after you today. Make sure you include the patient. A patient isn't a disease. A patient isn't a list of, I don't know, things, a list of medications that they take. Do not just look at the handover. This is just a random scenario that I've literally just conjured up to my head. Don't just look at the scenario, look at, oh, a 37-year-old comes with cellulitis in their leg and whatever, and think you know everything about the patient. No, talk to the patient, talk with their friends and with their families. I feel like a lot of the time, I don't know, people just feel like every single patient is, you know, is happy to take all of their medicines and is happy to, you know, sit and lie in bed and do exactly as you say. That isn't the case. They want to see how you interact with different types of people. Not every single patient has all their limbs. Not every single patient has their sight, but they do have so many other traits that you are able to use, you know, mutually to help you guys, you know, both help to improve or maintain the health and well-being of that individual. The main point, I'm not sure if I explained it very well, but the main point of what I'm trying to say is don't just think, oh, they're only 2 years old, I don't have to introduce myself, or oh, she's 98, she's blind and she's deaf, so I can do whatever I want and I can, I don't know, I can give her potatoes and she'll have to eat it. Like, don't have that snobby. If you've got that attitude, if you've got that sort of attitude, please don't even bother applying to be a nurse. Just don't. Some patients cannot walk, you know, some patients are actually paraplegic. Some patients don't want to take the medication you think is going to be helpful for them. Some patients don't actually want to do that, you know. Some people don't actually, some patients don't even want to be in hospital. Some patients, if you weren't there, they'd probably take their life. And basically what they want to see, I feel like what they want to see in simulations is how you interact with patients. The patient is number one, not you, not what the other nurse says, not what your list of things you need to complete says. The patient is the number one thing. And obviously your health and well-being. Those are my tips and advice and discussions and ideas and some questions and ideas and all of that I feel like would be really helpful for you guys. Like I said, I didn't just want to give you guys a list of questions because I feel like that it just limits you. So like I said, a lot of the ideas or some of the ideas that I have introduce or reintroduce you guys, I will try and link resources in the description box below, and if I've missed out any important tips and advice, they also will be in the description box below. If you haven't already subscribed to this channel, make sure you subscribe to this channel. Most of the videos that I do on this channel are nursing related, and I also have a second channel which is Maria Abbey Vlogs, where basically I vlog my day-to-day life. So yeah, if you are interested in my day-to-day life, make sure you check out Maria Abbey Vlogs. Links for that channel will be in the description box below. Like I said, if you've liked this video, make sure you give it a thumbs up. If you have any questions or any comments, you can put them in the comments box below, or you can email me, DM me on Instagram, on Snapchat, all of that good stuff. So yeah, I really hope you've enjoyed the interview. Oh my gosh. I really hope you guys have enjoyed this video and it's been useful to you in any sort of way. If you feel it might be helpful to any friends or family, make sure you share it with them. And also, if you have any tips and advice for other people in the community that you feel it might be helpful for, make sure you also put that in the comments box below, just to help other people out. I do want to say that I am aware of some nursing programs who don't manage to fill up their nursing spaces simply because a lot of the people that they interview aren't up to par or don't meet a certain requirement. So don't feel that, oh, if I withhold this information, I'm more likely to get a place. Honey, that's not how it works. That is not how it works. Yes, it is a competition. It is a competition at the end of the day, but withholding other people from information isn't going to put you into a better light. So yeah, good luck with all your selection days, with all your interviews and stuff. And I wish you guys all the best for your future. Bye.